Hi, my name is Dr. Richard Antbring. I'm a sport and exercise medicine consultant that works in elite football, private practice, as well as the NHS in London. I'd like to talk to you today about rotator cuff injuries of the shoulder. These are very common shoulder injuries that we see all the time in anyone from the less active to the elite sporting person. The rotator cuff is a group of 4 muscles that help stabilize your shoulder. The shoulder is a ball and socket joint and is capable of 360 degrees of rotation. Therefore, it's very important that these movements are very finely controlled, and this is where the rotator cuff comes in. These allow you to lift and rotate your arm in a precise and controlled manner. A rotator cuff injury may happen when one of these tendons are strained or torn or just irritated. This can happen usually from repetitive movements such as cleaning, painting, swimming, or for example, a sudden injury like lifting something heavy or bracing yourself when falling. People who have rotator cuff injuries often experience things like pain, which is the most common symptom that is felt usually on the outside of the shoulder across the deltoid, and this can extend down the arm, and it may often be worse at night and be difficult to lie on that side. You also might experience difficulties reaching overhead or behind your back, such as, for example, when taking something out of the cupboard. There might also be significant weakness accompanied with this, so you might notice that your shoulder feels a bit weak, making it difficult to lift the arm or perform daily activities. Sometimes there is limited range of motion as well, and patients often mention that their shoulder feels stiff, and it can be hard to sort of move it as freely as before, and some of the neck muscles might also stiffen up as a result of this. There can even be clicking or popping sounds that people notice from their shoulder. In terms of the diagnosis, in clinic, it's important that we look at the strength of your shoulder, exclude any neck involvement, and also make sure we know what movements hurt. This will give us an idea of the structures involved. Often this can be confirmed with an ultrasound scan in clinic. But should there be any doubt of whether there is a labral injury, for example, an MRI will have to be arranged. If there is any concern of a traumatic injury, such as a shoulder dislocation injury, then other imaging, such as an X-ray or a CT scan, will have to be done as well. Treatment often depends on the severity of injury, but initial rest is at least needed in the first 48 hours up to a week in order for us to reduce inflammation, and often anti-inflammatories can be helpful in this case. The key point after that is that we don't sit still and we start moving, and we try to strengthen the shoulder, because actually one of the main reasons the tendons are inflamed is because they're not able to cope with everyday tasks. And if we strengthen the rotator cuff muscles, then they're much more likely to cope with this in the future, and inflammation will reduce. If there is a significant amount of pain, for example, if it's disrupting sleep, then I would often recommend a steroid injection to try to settle the pain in the immediate time period. This will also help with exercises and also with the physiotherapy, as the pain will be reduced. If there is a full thickness tear of one of the tendons, which is relatively rare, then surgery might be something that needs to be discussed. In summary, rotator cuffs can be very painful and limit people's daily activities. With the right treatment, most people will recover fairly quickly and well.